COVID-19 is scary, no doubt, but the rising number of cases and deaths has led to an increase in many other fears, such as death, losing a close one, loneliness, losing a job, getting the infection again, and so on. India today has some case studies of people experiencing these fears and how best these can be tackled. If you are too feeling low and anxious about the ongoing situation, this video might help, but it is advised you take an expert or a doctor's help first. Now let's know, what are these fears?
Whenever I hear of someone dying of COVID, I just freeze. I'm unable to talk to anyone. I begin visualizing my own death.
I could hear the continuous wail of ambulance sirens, and without realizing it, I even began keeping count of how many I could hear in a day. Then one day I started feeling breathless. My chest felt tight, my pulse started racing, and my blood pressure shot up. I was convinced I had COVID. Soon I thought of my father, who's a heart patient. Would I pass on the infection to him? What if I don't find a hospital bed, oxygen, or medicines for him? Would he die?
I hope it doesn't happen to me. I won't be able to cope. My friends were in isolation when they got COVID, and being lonely, just like they were during quarantine, makes me really anxious. I keep checking for symptoms just to be sure I don't have the disease. Being alone in a room is something I won't be able to manage.
I really worry about losing my job. It supports my family. I lost my mother to COVID and I only took a few days off for her funeral. I cannot afford to grieve either, as it would leave me in no condition to work.
I spent 10 days battling COVID in an ICU in August last year. But even after coming back home, I would get flashes of the trauma I experienced at the hospital. I kept checking my oxygen levels obsessively and wasn't able to focus on simple tasks, as it would take a lot of strength.
Here's what the experts in the field have to say.
With the impact of the pandemic, there will be parallel or shadow pandemics. The pandemic of emotional distress, of mental health difficulties, the pandemic of the impact of socio-economic distress, the impact on livelihood.
A lot of pictures and videos, a lot of information about deaths and devastation causes this fearodemic. Recognition of this phenomenon is important for us to bring in interventions, treatment strategies, very simple and small, to get over the fearodemic.
Now let's look at some coping mechanisms.
So what do we do to take care of our mental health during this pandemic? Number one, I would say focus on the things that are in your control versus focusing on the things that are not in your control. Number two, I think it's very, very important that you can accept the condition for what it is. Accept that this time is really, really tough. There is a lot of uncertainty. Number three, practicing mindfulness is going to be a great way for you to stay in the present versus worrying about the future or ruminating about the past. Number four, finding meaning and purpose in life. Do small acts of kindness, do small little things that can bring in some purpose.
Find out more about these fears and how they are affecting the people, and also ways to alleviate COVID stress in our detailed report only in India Today magazine. And for more stories, get a copy today.